What's up, you guys? It's your boy Miguel giving your daily dose of radiation. Today's video, we're covering a typical day as an X-ray tech student, clinicals, the main radiology department, where all the fluoroscopies and all the main beautiful contrast exams occur. So to give you context, I'm a night shift X-ray tech, work a lot of day shift because of overtime, and at my site where I work at, we have students, so I'm well versed on what a typical day for a student looks like, and I remember pretty vividly what happened when I was a student, which it kind of really hasn't changed, especially where I work at. So the main radiology department, for those who aren't unaware, if you're new, that's where all your fluoro exams occur. You'll have esophagograms, enema, hip injections, lumbar punctures. You'll have small bowels. You'll have speech therapy that will come, and you'll do stuff like that. You have myelograms. You have one was called histo something. I can't remember the name. It's a lady one because you rarely do a cystogram. You have upper GI esophagogram. All of those beautiful contrasts, the barium, gastrographin, lidocaine, all the other good stuff. That is all found in the main radiology department. So the main radiology department, usually, for those who get there, 8 o'clock is typically when our department opens. It's from like 8 to 5, I think, for most days. And then it's like from like 8 to 4 on Fridays, I think. It all depends. Holidays, they're closed, so it's never open. And usually certain days are more centric towards the scheduled patients. So maybe from like 8 to 12 will be a set amount of like patients that have been scheduled from like coming like from outside the hospital to come do their thing. And then usually if we finish all the scheduled patients and there's time, we can squeeze in people who are from the hospital or something emergency or like other urgent stuff that gets added from the emergency room or somewhere else, can kind of get at the tail end. Typically towards the morning part is when you see a lot of your speech therapy stuff. That's kind of when they want to do it. Usually it's from like 8 to 10-ish is the range of hours. That's kind of where you see all those. For the patients who come outside, they get scheduled in. They have different blocks. Like you'll go in certain blocks. There's like a 30-minute block, an hour block, 15-minute block, depending on what's happening and how busy they are. So sometimes if a patient cancels or they can't make it or they don't show up, something else can get intertwined. Typically, half of your day, you already kind of know what to expect as far as workflow and stuff like that. In our department, it's 2 X-ray techs / a radiologist is if needed, and then you have the RPA who is down there the whole time doing all the, helping with the procedures and stuff like that. So typically when you get there as a student, you'll try to see if there's needing to restock gloves, linens, and all that stuff like that. You'll kind of look at both rooms, maybe talk with the techs and see what they got going on to see, what if there's something you need to prepare, check off, and stuff like that. And then you just kind of assist. Either if you are new to the department and you don't know, they can kind of give you like a walkthrough of like, hey, we do this like that. Because depending on where you go, your RPA, your radiologist, depending who it is, like stuff, even though it's the same thing, like stuff a little bit this, a little bit that, a little bit different, tweaking how they like stuff. That is with time. Your tech, whoever you work with, usually will know what to expect. So usually they'll either, if you're not comping, you'll just assist the tech, or they'll be right there next to you guiding you how stuff is done. Usually the RPA, ours is pretty chill. He'll be like, oh, I need this, I need that. They may ask you a few questions about what's going on, so you can maybe grasp their knowledge and stuff like that. So depending on what's going on, you may have to wear lead. Some of the times, if there's a lot of dosage going on, typically the X-ray tech will take over. But if you're trying to comp, you will be there and you try to reduce your dose of radiation. Our place for all the speech therapies, speech evaluation that happens, typically the tech don't do much but set it up, and then the speech therapist at our place does it with the RPA, and we're just kind of watching over the monitor and taking pictures and recording stuff and doing all the documentation. I know other places that I went to as a student, or even just asked other techs, they have to do the actual feeding and doing all that while assisting the RPA and the speech therapist. So there's that. For upper GIs, typically that one, you just give them the little fizzies, they'll drink it, and like the RPA will kind of just shoot them and just kind of watch them as they, down their throat. And then as they turning and moving, you will feed them, the contrast. That one's not that hard. And then you have the small bowel. Once again, typically that one, you'll kind of tell them, what to expect, go over through any basic like brief histories, and then the RPA comes in, tells them kind of the same thing, and then you give them the good contrast. They chug it, take pictures before they, like the scouts, and then after they chug their contrast, they shoot them. Typically with those take a little bit longer, especially you have like the 15 minutes pictures, and then the 30 minutes, and then an hour, and then every so many hours. I think it goes like 1 hour, 2 hours, and then 4 hours, depending on your protocol. And then the RAD or RPA will look at it, and then it says, oh, okay, yeah, it's done. And then you tell the patient, hey, since you drank a lot of contrast, make sure you drink a lot of water, because it can make you constipated, or it can like dehydrate you, because the contrast pulls a lot of water like from your system and stuff like that. So that's something you kind of go through. Usually it's not that hard. It's either you like it or you don't. I personally don't like it. I'm more of just a plain X-ray type of person. So night shift, you really don't have to deal with none of that. Only if emergencies. I've only done one contrast exam, and there was an esophagram, and that was one time out of the past 4 years. Not that bad. So it's never zero. It's like 1% chance that it can happen. But that only happened because it was like before midnight, before the rad left. That was really the only reason we really did it. Because most of the stuff, like, it can be just CAT scan. So typically you'll have like an hour lunch break there, 30 minutes, an hour, whatever. I think ours is scheduled an hour break. And then you come back, restock if you need to, and then finish out the day. Get all your comps and stuff you don't need to. Sometimes, depending if they shut down early, you may get if it slows down a lot, you may get put into the emergency room, or you may get put to the patient out building, because there's nothing happening in the main. So that's kind of about it. Usually it's a pretty, you already kind of know what to expect as far as workflow and stuff. Yeah, it's been Miguel. See you on the next one.